Good morning and good afternoon to everyone. My name is Krista Nelson. I'm an oncology social worker at Providence Cancer Institute and program manager of the Department of Compassion. I'm also the 2021-22 president of the Association of Community Cancer Centers, or otherwise known as ACCC. I also happen to be a past board member of APOS and a past president of AOSW. So I'm very grateful and connected to all three organizations that are here today. On behalf of ACCC, AOSW, and APOS, I would like to welcome you all to this conference today, and it is called Achieving Health Equity in the Psychosocial Treatment of Cancer Pain. I also want to take a moment to acknowledge how difficult it can be to take the time for your own needs when work schedules are so hectic, when patients and providers need supportive care staff more than ever due to all the stressors of this pandemic. So I want to thank you for making this commitment to yourself and to your patients by being here today. I wanted to take a moment and share a little bit about ACCC with you, as I'm aware many of you may work at institutions that are members of ACCC and you might not know it. I wanted to say just personally, I felt embraced as an oncology social worker in this truly multidisciplinary organization. We actually represent over 2,100 cancer centers and practices across the country and 28,000 individuals who are involved in the care of people and families with cancer. I encourage you to check out our website. You may find a lot of resources that will make your job easier. As ACCC president, I've dedicated my tenure to identifying real-world lessons from COVID-19 with a focus on driving oncology care forward, where I'm committed to these three main areas of focus: health equity and social justice being critical drivers of quality cancer care, the escalating need for high-reach, high-impact psychosocial and supportive care services, and last but not least, strengthening a culture that supports the professional well-being and resilience of the cancer team. And I'm really pleased to see that these three lessons are represented today on our agenda. We can consider for just a moment that there are over 700 team members registered for today's program. It's truly incredible. And I think it speaks to the need for discussions around ending disparities in pain treatment, achieving health equity and supportive care, and the desire for genuine change among our community. I'm excited to hear more about your thoughts during our question and answer portions today. But before we go further into the program, I would love it if we could take a collective moment to center our thoughts with a short breathing exercise. So if it's comfortable for you, wherever you are, trying to just settle into your chair, maybe lower your gaze or your eyes, and just settle into your breath. You may notice energy in your mind, in your body, and of your day. But try to just settle into the chair and focus on your breath. Trying to let go of everything before this moment and of everything else you have to do today, and just settling into your breath. Maybe thinking of a shaken snow globe with all that energy and thoughts swirling around like the little snowflakes in the globe. And as you settle, imagine the snowflakes falling gently onto the ground. Bringing your attention to your breath in your body. Maybe choose one spot where you feel your breath easy. It may be the center of your chest, your nostrils, your abdomen. Just observe for a moment the physical sensation of your breath. Like in the snow globe, as your thoughts begin to rise up, observe as they slowly settle back down. Take one more breath. And when you feel ready, open your eyes. Thank you so much for spending just a moment to settle. Hoping today myself to be able to stay away from my distractions and give these presenters the same attention I would give my families that I work with or my patients. It's now my pleasure to introduce Bill McDermott, AOSW president. Bill is a dear friend and has been an oncology social worker for over 30 years. He has recently retired as the social work manager of NYU Langone Health Permeter Cancer Center. Sorry if I mispronounced that. He's been a longtime member and leader within AOSW. Welcome, Bill.
Hi, Bill.
Yes.
Go ahead, please.
Oh, thank you. That felt so good, Krista. Thanks for that introduction and exercise. Hello, my name is Bill McDermott, and I'm the president of AOSW. As an association, we have recognized the importance and benefits of collaborating with like-minded organizations. And I'm thrilled that AOSW, APOS, and ACCC have come together to present this timely and important conference. COVID greatly revealed the racial inequities that exist in healthcare, and it forced many cancer programs to take a look at what could be done differently to improve the system. And that, of course, includes the management of cancer care across, or cancer pain, across various communities. Our conference will help to address this. The topic of health equity is very personal to me and to many in our organizations. As a social worker, I have been fighting for over 30 years to eliminate the disparities in healthcare and to achieve health equity. And as a profession, we must continue the battle. Justice is simply in our DNA. If you feel the same way, please consider joining our organizations. I would like to thank the staff of the management companies of the three organizations for their efforts in putting this together, as well as the speakers for being willing to present. And I would also like to thank our sponsors for their generosity in helping our event today. So as I send you to Joe Greer, the president of APOS, our hope is that you will be able to take what you learn back to your institutions today and affect real change. Thank you, and I hope that you enjoy the conference. And now I'm sending you to Joe Greer, the president of APOS. Thank you.
Thanks so much, Bill. Hello, everyone. Again, I'm Joe Greer, a clinical psychologist at the Massachusetts General Hospital and current president of the American Psychosocial Oncology Society. As some of you may know, APOS was formed in 1986 to bring together professionals working in the psychological, behavioral, social, and spiritual aspects of cancer. We have over 500 psychosocial oncology professionals gather at APOS's annual conference to share new research, clinical, and programmatic innovations. This year, as part of our diversity, equity, inclusion task force and strategic planning work, we have taken time to engage our members and the community through surveys and a range of listening sessions to evaluate our progress in fostering diversity, equity, and inclusion. These efforts have enabled us to glean incredibly helpful insights as to how we can enhance and grow our organization, as well as stand with other partners in combating racism and promoting inclusion. In line with this goal, we have revised our mission, vision, and core value statements. As noted here on the slide, Our first core value now is that we advocate for diversity, equity, representation, and inclusion in advancing the science and practice of psychosocial oncology care, recognizing the rights of all those affected by cancer to receive comprehensive, person-centered care. We are so pleased and excited to have this opportunity to collaborate with the Association of Community Cancer Centers, as well as the Association of Oncology Social Work in delivering the wonderful programming here today. And we thank the panel of expert presenters for their contributions in helping us learn effective methods to overcome disparities and promote equity in comprehensive and supportive cancer care. Our hope is this is the beginning of many joint ventures, given our shared mission to advance the delivery of equitable and evidence-based psychosocial oncology care through research, practice, education, and advocacy.